Welcome everyone to the first of 4 webinars on opening up in a pandemic and the perils for people with disabilities. We're just assembling everybody as the participants join in, and we will get started in a moment. Thank you. Welcome everyone. My name is Judy Mark. I'm president of Disability Voices United, an organization led, directed, staffed by people with disabilities and family members, and really want to thank you all for coming today and joining us in a first part of a 4-part series about opening up in a pandemic, the perils for people with disabilities. Many of you know that even though California's cases of COVID are increasing as we speak, and more people are getting hospitalized, we are still, we are opening up, and that's why we are having this series. Before we get started, I wanted to ask Lorna Silva, our Spanish interpreter, to tell people how they can join by phone to get Spanish interpretation. Please go ahead, Lorna.
Para las personas que hablan español, si quieren escuchar la interpretación simultánea de este webinar, llamen al 551-241-6310. De nuevo, para español, llamen al 551-241-6310. No necesitan ningún código más. Gracias. Thank you.
Thank you, Lorna. The other thing that I wanted to mention as we move forward today is that all of you are able to send messages through the chat to us and ask us questions. But if you really want to ask a question about what the speakers are talking about, we prefer that you do it through the Q&A. You can find Q&A at the bottom of your screen. That way it's much easier for me to keep track of what questions come in and making sure that we get all those answered. If you want to put something in the chat, it really should be more about concerns about the way that the call is going, like you can't hear, or you're having problems seeing things, or you have, you want to get on our mailing list, all those kinds of things should go in the chat. But if you have a question that you would like our speakers to answer, you should put that in the Q&A. So before we get started, I'm going to go back to sharing my screen to show what we have been, what we're up to. This is a 4-part series, and I wanted to show you the dates of the next ones. Hold on, I have it on a play, so I'm just going to do this, and you will be able to see it. So these are the weeks. Oh, I do have a date wrong. You are correct. It is not June 16th. I have to change that. I'm going to change that right now so people are seeing the correct date. It should be June. It should be every Thursday. So I apologize for having all these dates wrong on this slide. So it should be June 18th. See, I'm a volunteer, so I get to make lots of mistakes. June 25th, and then we're skipping a week, and oh my God, I never updated these dates. It was correct in our emails. Change it to Judy. July 9th. Okay, there you go. See, you're getting to see live action how we make mistakes and correct them on the air. Okay, so it is June 11th, June 18th, June 25th, and July 9th. What we are doing Oops, it went too far. I am sorry. The technology is not my best. All right, so we'll just show you guys this. Next week we're going to be doing a webinar called Inclusion No More: People with Disabilities Being Left Inside While the World Reopens. We're going to be having some amazing speakers that I have yet to actually reach out to, but I know they're going to do it, who are just really big thinkers about, they are people with disabilities themselves, advocates for people with disabilities, family members who have really thought about the fact that we have not found a cure for COVID. We haven't even found an effective treatment for COVID. And all these people are going out in the world and they're going to be left behind. What are the ethical and moral implications for that? On June 25th, Thursday afternoon, we will be focusing on congregate and group settings, how we can't go back to the way it was before. We will be having Chris Gebhardt from DDS has already been confirmed, who's helping to think about how group and congregate programs are going to reconvene in any kind of way, and how they're going to look very, very different in our community. Finally, our final one will be after the July 4th holiday, even though a holiday is the same regardless of when you are. In COVID, every day is a holiday, I guess, or every day is not a holiday. On July 9th, our final one will be getting back to school and work. What will education and employment look like for people with disabilities? There's actually a really great op-ed in today's New York Times by a woman who's the mother of a child with Down syndrome, who is keeping her and her two siblings home for the entire summer and not going to any kind of summer camps because they're so afraid of catching COVID. So wanted to show you that. These are our speakers for today, which you've all seen: Dr. Laveeza Bhatti, Carolyn, Tellalian, Sherry Johnson, and Lisa Cooley. Also wanted to mention that Disability Voices United, we are very active in the self-determination program. We are starting to offer every Wednesday something called SDP Connect, which are weekly meetings offering assistance in the self-determination program. We're doing that on Zoom. Join our mailing list so that you can learn about how get the link to be part of that. We had our first session last night. I thought it was excellent. We had like 75 people on it. Finally, find out more, go to our main website of disabilityvoices.united.org to get on our mailing list. Go to our coronavirus resource website, disabilityvoicesunited.org/CV. This is our 12th webinar that we're doing, and you'll find all the other webinars that we've done on that website. We also have two forums, one on self-determination and one on the rights to communication. It's at theinterchange.org. That you can find and ask questions and start conversations. Finally, to join our mailing list, you can go to tinyurl.com/join DVU mail, or donate to us at DVU donate, or become a member at DVU join. Okay, so we're gonna get started now. Sorry for all the mistakes that I made, but my husband will tell you that I'm very human and I make lots of mistakes. So he can verify that at any time. So we're going to get started today with an amazing presenter, Carolyn Tellalian. Carolyn is a clinical social worker in the Fresno area at Fresno Valley Children's Hospital. I hope I got the name of that, but you can correct me if I got the name of your hospital wrong. And who sees people, she has patients every day that she sees who have underlying health issues, who are really at risk, and has consulted with also some doctors in her hospital about some of the advice they've been giving. So thank you so much for joining us, Carolyn, and I'm gonna have you unmute yourself and you can get started.
Okay, thank you so much for having me. It's funny because this is what I know and live with every day, yet I still get nervous talking in a live session. So I just wanted to pass that on. Anyway, so I'm going to introduce myself in just a few sentences, just a little bit more than what Judy did. I have a 31-year-old daughter with Down syndrome, and she lives in a home that she shares with her 2 best friends. They rent the home, and it is not a group home. I always like to put that there. They have been together for over 4 years, and us moms hired the agency to provide staff for them to support them as needed and to provide for safety reasons. In the hospital where I work in the Employee Family Care Clinic. It's newly started since COVID came about, and we see families, employee families and our board families, and so I see people who are being tested for COVID and positive for COVID, so I'll have some more to say on that later. Also, even more importantly, maybe for over 2 years, I've been doing the transition clinic. It's a young adult clinic for adults 18 and over who have medical conditions, lifelong medical conditions. And I have found that over 50% have intellectual disabilities to go along with that. So I really see a lot. I actually ask every single family, do you know about self-determination? And I've had one answer yes. So I'm an advocate to help them get that information. So first I want to talk about the things Judy kind of asked me to do about the group or their home, which is not a group home, but the home that they live in, and how we put some early safety features was the biggest thing. So safety when visiting parents' home, the 3 of us got together, and all our girls come home to visit us on Sundays, but we've all agreed to keep limited social distancing while we are in the pandemic at this time. We all have minimal contact with other family members. I have not even seen my mother, who turned 91 in May. So anyone who lives outside our home, friends, I don't have anybody come over. So that's one thing for visiting. Safety when going out in the community. The staff and girls are always wearing masks to go to the grocery store, and this is their 3rd week. Until now, we kept them at home. They did not leave their house except to take daily walks, which were mandated by the parents to our own girls to say that you got to get out of the house. So as the community is opening up, we are deciding what activities that we want the girls to attend. So this is the most difficult part, I think, for all of us. So we're assessing the safety measures that are in place. And so like at the program, her dance classes, she had Bible study, she went to a philanthropic group that she belongs to. We're checking all those and finding out what they're doing. So we are now allowing them to go to 1 dance class a week. After checking with the agency about precautions that they're taking, we'll soon decide if we want to start their art-based day program that she attends a couple days a week. I'm in direct contact with them, and I'll talk about that in a minute. Safety in the home is huge, as we know. First, I'll talk about staffing agency. We had about a dozen staff coming in and out of the home, and at the time the agency said that they couldn't reduce that rate. Well, funny, they were able to reduce it to 6 now during COVID, which has been good for us, and also to let us know it can be done. We check to see what they have in place with CDC guidelines for the home, and we keep on top to making sure it's communicated with all the staff, and make sure the staff are all wearing their masks and cleaning throughout the day, and we make random stops at the house to see how things are going. For safety in the program for our girls, which is a big deal, I received the program protocols, including transportation, arrival, programming in the facility, programming in the community, and the professional cleaning services. So I looked at that, and I emailed the program director of operations and asked them to have hand sanitizer in each room so that the students can gel in and gel out from moving to room, because they were saying that there were planning to, and they wanted feedback, which I give them credit, but they were going to just encourage hand washing. That's not good enough in my department, because here at the hospital, we're the most careful, and I will gel in and gel out when I enter and exit a room, no matter where I'm going and how clean it's supposed to be. So safety in the program, that was that. Let's see. And when she's taken to the program by her personal staff, each girl has their own personal staff to take them. They're instructed to clean the outside and inside door handles before transporting. Go ahead. Yeah. One of the biggest things, and I think people kind of forget, they see things as problems and forget what to do, but I deal with this a lot. Every single person has reactions to COVID, either being tested and worrying that they have COVID, or if they have it, and that is the mental health and well-being considerations. So for our kids and young adults, we really need to listen and be aware of our children's mental health and be watching their behaviors. As we know, all behaviors are communication. So they're telling us something by what they say or their actions or both. This is where we need to balance the risk and benefits of going out in public, whether it's to see other family members, which Marissa has not seen her grandmother either, or going to a program. So, but with each person I've talked to about COVID, getting out of the house, getting some fresh air, getting the sunlight, not being in one room, even if they're positive, is something that is important for them and all of us, so that we don't think that social distancing is never leaving your home. It could be your front yard, backyard, it could be with a mask to walk around the block, as long as you're not getting near other people. So also we need to set them up for mental health or behavioral health services if needed. Marissa had one outburst because she thought her girlfriends, her roommates, were going to go to one of their other houses to go swimming, and she was being left out. But actually that wasn't the case. So we needed to look at that. Why was she upset? And when I asked her, and although she doesn't have a lot of sentences, but a lot of words, she let me know that they were going to go to Kyle's house, her roommate's house, and swim, and she was upset. So we really need to be on top of that. So I would check in with them at least weekly, whether you live with them or not. How are they doing? How are they coping? Say, how are you? And even put some words out there for them if they don't have them readily, like, are you sad? I said, are you sad? Because I always ask, are you happy? Are you sad? And my other question I ask weekly, is someone hurting you? Because I think that's what we all need to do too. Another thing is we keep the girls really active. So I would suggest that with anyone who's at home or in a group type setting, is that we set them up with outdoor games and activities. They can go out and play a lot of different things. They also have lots of arts and crafts in their garage, because we turned that into an art studio and had group art studio classes with a private person before. So they can still go out there and they still do that. And that's, again, moving around, getting into another room, another space, getting some fresh air. So one of the questions Judy asked, and I think it's important, is what are we telling our families in our family care clinic? So if you remember anything, you are far more likely to get COVID from unprotected family and friend gatherings. Across the board, everyone who's come in typically has been exposed by someplace they've gone. It could be weddings or funerals, barbecues, just so many family members living together, and each going out, you're just multiplying the chances. So definitely be watching for that. I had a family with 8 family members and 7 were positive. One brought it into the house. She was the sickest. She went to a hotel, and the rest of the family got it. Children to 11 years old on up. It was a multi-generational house, which many of our ethnic, including Armenian or Hispanic or Black families, they have multi-generational homes. And so you're putting somebody at risk who's older, who may have health problems. But as we know, even the middle age group is still getting it. So another thing to really remember is the test is not comfortable or easy for adults, let alone for children to endure. So if you wanted to know, my biggest concern is I would not want to try to get our population with an intellectual disability or autism to try to get that tests done. I think Marissa would push them away and not have it done. So a lot of the young kids we just treat on the symptoms they have, because there's no reason we wouldn't do anything different. If we had a negative or a positive result, we would still treat them for their symptoms, you know, whether it's Tylenol, ibuprofen, or whatever, that would happen. And just wear masks and wash your hands all the time. I know they say that over and over again. We're kind of like, yeah, but we really, really need to just wash, and wear a mask when you go out. And especially now, since I went to the grocery store the other day and there were so many people without masks. And I know the chances of me getting sick there are not high, but if there's one person who coughs on me or sneezes on me, that's not good. So I wear masks to protect myself and others, and I hope others do too. And another thing that people forget, and we had a bad outcome for someone, is our kids with an intellectual disability and medical conditions, if your doctor asks you to come see them for an appointment for their heart, their kidney, their liver, whatever, go to the doctor. Do not be afraid. One was afraid to go to the doctor. Their group home person who led them and said, I'm afraid to bring her in because of COVID. She had ended up passing away from a heart attack unexpectedly, but the cardiologist asked her to come in. So please go in when you need to. We are ready for you. We are more than ready for you. Cleaning and sanitizing, and our ERs are exceptional places to go. If you are that sick, if you're just a little sick, you call your doctor and he will guide you. So a couple smaller things to talk about, but I know this came out recently. So I talked to my doctor about it, was the NPR study, the COVID-19 infections, deaths, and that are higher among those with intellectual disabilities. Just a couple small notes on that. This is what we know and the study showed. This was no surprise. It's disturbing, but it's not surprising. So one is to look at it in three areas. First is we get COVID and have worse symptoms and die dependent on age. So we know right now most children are doing much better. Adults are more likely to get COVID and have a poor outcome. Those with in that middle age that they showed, and I think it was it 18 or 17 on up, those with medical illnesses, of course, then they're another tier up in getting COVID and having a poor outcome. Ours, thirdly, is what they found and what we see is our population of people with intellectual disabilities are most likely to have pre-existing complex medical conditions. So if you have a child with ID without any medical problems, they probably are not going to get COVID as easily as, say, my daughter who had open heart surgery and who's more vulnerable. So this is something you need to think about as you open up, and again, balancing your risks and your benefits of getting out and doing out and how much you want to do. Lastly, I sent some resources in, and they're planning on posting them if they haven't. I can't check while I'm talking. And I just wanted to go over a couple sentences of them. Something a lot of people weren't sure about yet or didn't know, because it only came out in May, was under the state California Health and Human Services Agency. There's a new guidance in May stating that if your loved one goes to the hospital for COVID, you are allowed one member to be with you. Remember, we had people in the beginning of this dying or having babies with no loved one with them, and that is really tragic. So now we can be there, and I have the website to look up that guidance. Also, I have a healthcare summary that I like from Florida. It's my favorite one. My daughter has it. It's in her house. I have one also with me at all times. It is for a hospital. There's an H at the top of it. So it talks about what to do and not to do when I am in the hospital as a person with an intellectual disability. What comforts me? What upsets me? What do I need? I really like that. There's also one for seeing a doctor. And then also there's the DDS has a coronavirus information and resource page. It's excellent. I would look it up. I would see what things are in there. Sometimes it's just a repeat of what you know if you've been on other CDC websites or are doing part of this business, but it can give you a few little tips here and there. And also the State Council on Developmental Disability has a plain language information. What I really liked about that is I printed it out. That can be given to each girl. They can color on it, draw on it, look at it. It's their own little book of what does COVID mean to them and why they need to wear masks and why they need to wash their hands. So those should be posted, and I hope you'll take advantage of them. So that's it for me right now, Judy.
Thank you so much, Carolyn. That was great. I also want to mention that health passport that you talked about from Florida is available on the DVU's coronavirus website. We have a link to that. We have a lot of resources for people with disabilities, family members, service providers, and that's at disabilityvoicesunited.org/CV for coronavirus. So now I'd like to present our next speaker, Dr. Laveeza Bhatti. Dr. Bhatti is an infectious disease specialist and is also a physician at the Achievable Clinic and at Westside Regional Center. So we really thank you for joining us. Laveeza's been on our webinars before. I was going to say on our program as if we're like some TV show. On our webinars before, and I've asked her to talk about a whole bunch of things, including what the heck do we do when everything's spreading and what are you seeing for the future? So go ahead, Laveeza. You need to unmute yourself.
Okay. Yeah, thank you. I thought I was unmuted. It's a pleasure to be back again, and I will speak initially, and then I certainly would like to have some questions because over this time, there's two aspects that I wanted to address initially. First is that for the patients that I see, as you know, Achievable sees a lot of patients with disabilities, and also at the Westside Regional Center, I get a lot of questions about two aspects that people are doing that I think are concerning. Is we're not taking this person out at all because there's coronavirus. The aspect certainly to know at this time is that just because somebody has a disability does not mean that they're at higher risk medically. Now, there are certain concerns that are there, hand washing being one, wearing a mask being another, that in case that is difficult and complicated, then that does make you more prone. But certainly everyone at this time should be able to go out of the home. And I know that you may find this interesting that that's happening, but this is a consistent thing that, have you done anything? No, we've kept them home for the last 3 months, not stepping out of the home. So I really want that message that stepping out of the home is perfectly fine. Remember that if you are at a certain distance of 6 feet, and if you're not in a crowded place, it is okay to take someone outside. One of the things that we have tried is different kinds of masks, and there is no reason to have, I'm just kind of going over the things, the kind of questions that I've had and what people have been doing or asking. So I wanted to make sure I address those. There's no reason to get an N95 mask. It's first of all, it is really meant for high exposure professionals. If you're an anesthesiologist, or if you're going into a room with a patient that has a TB, for example, and you wear a mask like that, for just generally going outside, an N95 is not an absolute necessity. So that's one thing I wanted to clarify, because I've had this, no, we're not going to go out because we don't have an N95 mask. Just a common surgical mask or anything else that you can cover your mouth with is good enough. The virus really spreads by droplets, but it spreads by the amount, or causes disease by the amount of virus that the body gets. That's why you hear about a lot of doctors and nurses getting sick from the virus and getting bad disease because of the level. When you take someone out, as long as you are not in a crowded setting, they have a mask, and you keep them away from a lot of people, you certainly want everybody to be going out of the home, not being kept captive inside a room because that's what people think is the right thing to do. That is not the right thing to do. I also wanted to talk a little bit about, there was a new WHO's World Health Organization statement recently saying that people that are asymptomatic, there is very little evidence that they spread infections. And I don't agree with that statement, because there has been sufficient evidence that people that are in, for example, there was a choir where people were singing, and one of the people that was asymptomatic actually ended up infecting some of the other choir members, and 2 of them unfortunately died. So it's really important to understand that somebody can be asymptomatic and then be able to spread an infection. So I don't want people to kind of let down their guard at this point, saying, oh, we're just sitting with 10 people who are perfectly healthy. That is not the right way. You need to have a mask on when you are with people, and especially for our population. That's really important. Let me see, what else should I, Judy, anything else that you want me to address? Kind of address the main important points.
So should people be wearing gloves when they go out?
So I don't think so. And the reason is that it makes people very uncomfortable. And for our population, a mask is a way more important aspect. Remember that this is a respiratory virus. It's only going to enter through the nose, the mucous membranes, most commonly the nose and the mouth. There is some concern with the eyes, but it's not a significant concern at this point. So it's really important to cover the mouth. I have not had much success, nor do I believe in doing gloves on the hands, because it's very uncomfortable. The best thing that I would suggest in that circumstance is just having wipes. That if you're touching a lot of surfaces, or if someone is getting up and going on a swing, for example, in the park or whatever, then you just wipe down the hands, and that's the best thing to do it. The other thing also is, remember that there is no absolute necessity to have a mask on when you're not near another person. So your own household people, or people that you're exposed to on a daily basis, you are essentially not, whatever they have, you're going to have. So there is no additional risk. If someone is with you, that is with you on a regular basis, a member of your household. So if you are going out to a park and you're taking a walk and you are only with that person, it's perfectly fine to take the mask off. You don't need to stifle the person that already is not liking a mask. It's good to make a condition and try and help them understand that a mask is for this period of time, or for when there are other people there. So that's important to understand, that parents or family members or caregivers understand that they can take the mask off. That's one of the barriers that has been consistent with people not taking anyone out of the home, because they won't keep a mask on for the whole length. Well, they'll keep it on for as long as they understand where the risk is. There's lots and lots of places to walk where there's nobody walking. And then the other thing that did come up that Dr. Fauci had mentioned that I wanted to mention also is runners, or people that are doing any kind of heavy exercise, biking or rollerblading or whatever, that generates more respiratory usage, because the force of the virus and the ability for it to infect is based on the strength of the expulsion from the respiratory tract. So if somebody is running, it's a good idea to change your route and go on the other side, or put a mask on if you don't have it at that period of time. I think that's one thing. Sure.
So right now, the State Council on Developmental Disabilities is passing out masks and hand sanitizers around the state, but they also have been passing out shields, those plastic shields. So we now have access to these. We just got ours the other day. My son is one of these people who can handle a mask, shockingly. But there's a lot of people with autism where having anything over their mouth, having that constricted, is very, very hard for them. But I really think this shield, which is totally clear, is a better possibility. You think that shield, which goes probably right below the chin, do you think that provides sufficient enough barrier for them where they could use that instead of a mask?
I think so. So ideally, you should have a mask because that's the closest to your face. Yeah. But I totally get it, how difficult it is to keep a mask on for. And one of the things is that there's different kinds of face shields. The one that I like the best for our population, I wish I had it here. I don't have it here, but it's like your sunglasses. So it basically starts at the forehead and it goes, it kind of loops around the ears. It's very comfortable, rather than the ones that are Velcro, because that has been a problem with people keeping, it feels suffocating to them, versus having something that goes and loops around your ears and basically is like your sunglasses, for example. And that shield goes in front. That is very good, not as good as a mask, but certainly is perfectly acceptable to use.
Yeah, the ones that they're handing out for the state council goes around your head. It's kind of like an elastic around your head, and it has some cushion here. I can go get one during our next speaker and show people. I could see the airs coming in from underneath, but I actually think for instead of no protection, I think that's better than nothing.
Absolutely, totally agree. Yes, and if you are in a very high area where N95, by the way, is a very difficult mask to wear. And I mean, I can't last more than 5 minutes in it. It's very suffocating for me. But everybody is different, of course. Some people can handle it. It's way better if you're in a very congested environment for whatever reason, in a bus or somewhere where there are lots of people, then you can use both. You should ideally in a big gathering or where there's people, use the face mask as well as the shield.
Okay, great. There's a couple questions which can go to both you, Laveeza, and to Carolyn that have come up that I want to pose. So Wesley was asking that there's so many different counties around the state. And I know you, Laveeza, are in LA County, and Carolyn, you're in Fresno, two very different kinds of areas. But there's all these different counties which are all having different kind of rollouts of the reopening. What is the best place for people to find information about what they're allowed to do in their county and what's being opened?
I've actually been referring everybody to the county health department. I'm not sure if that's a great resource for our population, but I wanted to go by what they are saying before we put our interpretations in as well.
For me, can you hear me?
Yes.
Yes, for me, I do the same. I send them to the Fresno County Health Department. However, I think kind of what the doctor said too, you have to look at it not only for our population, but for others. With our person who was put in a hotel by the county health department, they told her she couldn't ever even leave her room, not even with a mask and a shield, and go walk in the parking lot. She was going stir crazy. Mental health was a big issue. Again, looking at the balance of mental health and well-being versus risks and exposing someone else. I said to her that my doctors, we've been telling people, for like her to go to the parking lot with the proper protection, staying away from anyone, even if they're starting to go down the hall, go the other direction, so that she could get out. So basically, yes, we're 99% following what they say. But again, I think you need to look at it for our population too, what's going on.
Lots more questions. Sorry, go ahead.
No, I just wanted to add that's like you mentioned about this lady in the hotel room. That's been a really, really major problem. That is why I stressed it in the beginning, that people are keeping our folks captive at homes. Mm-hmm. And there's leading to a lot of problems and mental health issues, and it's just really important to get this message across that for goodness sake, get them out of the home. It's safe as long as you know what you're doing.
Right. Thank you for that. I know I just got an email from some parents whose adult son lives in a group home, and the group home's not allowing their son to leave and not allowing them to see their son, even in a socially distant way. And the son, of course, is falling apart because of all this. It's 3 months they haven't seen him. So yeah, I'm glad you mentioned that. So somebody is asking, kind of similar to what you were saying about this person in the hotel, if you live on the top level of an apartment building without an elevator and encounter residents in a narrow stairways without a mask, talking as well while exerting themselves while climbing up the stairs, do you need an N95 mask? This is something this person has it as their reality.
So if there's multiple people there, it's safer to use an N95 mask because you're very certain of the protection. However, if you are exercising too and you are breathing heavy and you're going up the steps also, then it makes the N95 not very safe because you are breathing the air that you just let more carbon dioxide, all that air that is going back in. So yes and no. I would recommend using a face shield and using a regular mask. To me, that is much more sensible than an N95.
Okay. And try to avoid people walking on a closed stairs. Go back up. If you see somebody coming up, you're going down, go back up the stairs. Walk far away from them. Let them pass, or yell out at them if they're coming up. Please go back down the stairs. I'm halfway down. Let me pass you first. I have just been very aggressive with people as they're coming towards me without masks on. I'm actually very, very worried about how people are throwing caution to the wind, walking around without masks everywhere. And everywhere I'm going, people are not wearing masks. Just a couple of housekeeping things that I want to apologize to people for. Our fabulous person who does our interpretation, our Spanish interpretation, Lorna, had a fluke power outage in her house and lost all her ability to be on Zoom. And so she has not been able to provide interpretation for the last 20 minutes. And we completely apologize. It was a fluky thing. She's back in now, and we thank her and we apologize. That is such a bummer, I know, but she's back on. And so those of you who want the Spanish interpretation, please go back into that. The second thing is we just want to let you know that if you have questions or you want to ask the speaker something, please do it through the Q&A. Don't raise your hand or anything, because I won't be calling on speakers.
Muy
this
bien.
is not a meeting.
Regresamos. Si tengo alguien en la línea y si me
Perfect.
escuchan y
Oh,
volvemos.
we're hearing you, honey. There you go. Okay. All right. I'm going to ask one more question. Laveeza, I know that Laveeza, you have to go at 3:15, 3 o'clock? Tell us again.
3:15 would be good. Yeah.
3:15. Okay, so I'm going to go ahead and go to Sherry and Lisa real quick, and then we're going to go, we have a lot more questions. We're going to go back to the questions. So now I'd like to introduce Sherry Johnson. Sherry is an amazing mom of an amazing young man named Joseph, who's a great singer and dancer, particularly to Michael Jackson. And Sherry is also, in her other life, an essential worker and has been going to work every day during the COVID crisis at working for the Social Security Administration. And we know that she's had to take lots of precautions in her household, and thought, who better to ask for advice about going out? We might as well ask the person who's been going out all along and what you've been doing to protect yourself. So thank you for joining us, Sherry.
Thank you, Judy. Hi, everyone. Like Judy said, Judy is actually Department of Social Services, Los Angeles.
Oh, sorry. Oh, sorry,
not
everybody.
Social Security. Similar, very similar. I've been with the county since 2005 as a public servant. I work with women with children in the CalWorks, CalFresh Medi-Cal department. So I am an essential worker / they like to call us disaster workers. This has been really interesting for me because not only am I an essential worker, I'm also part of the same community that I serve. So I serve people that are very financially insecure, have suffered from food insecurities and homelessness, but I also live in the same community that I serve. And luckily I am with a union, SEIU, so our union's been very proactive, making sure that we have PPE and necessary protective gear, while other friends of mine and co-workers who are not with no union are really at risk right now with their employer maybe not providing the necessary protective necessities that they need. I know since this pandemic, everyone probably has realized how important the essential workers are and how detrimental we need them. Without the essential workers, things are very, very rough. For me personally, the first week I could not go to work. I was scared. I didn't want to go in. They weren't allowing us to really telework at all. And if you were allowed to telework, they would do it based on seniority and people who had pre-existing conditions that really, they were at a much higher risk of getting very ill. For me, I've been very careful to hygiene, washing my hands. As soon as I come through my front door, I have this little closet I go to and just take off and change into like a robe and go straight to the shower. My son has asthma, so on top of that, he's very, they would consider that a pre-existing condition. Myself, I have a pre-existing condition, and I have my mother also that's extremely close to me where she relies on me that I cannot not help her. So I have to definitely go see her and check on her. What else? I really want the public to be aware of the essential workers when you're out and you see them in the grocery store. And if you see the worker does not have any protective gear, I want you guys to go request to speak to a manager. Maybe not directly to the worker you see that's not protected, but go speak to a supervisor or a manager and just give your input. The public, let them know, hey, this person should be wearing a mask, is there any way you can help them? Put some a flame underneath these employers who are not following the instructions from, the governor regarding PPE. What else did I have? Also, definitely like washing your hands, hand sanitizer, face masks. That's been very important for me to stay healthy so I can go out and still provide for my family and not bring anything back to my children.
Do you have to wear a mask at work, Sherry?
Yes, we have to wear a mask, and we're actually, with the accommodations that the county made in my department, we're social distancing also. A large amount of our my coworkers, you believe they have some 65 and up, and in their early 70s and mid 70s that are still working because they have to. So they were allowed to work from home automatically. So it was a seniority based illness, you know, pre-existing conditions were allowed to work every day from home. Yeah.
Oh, thank you. So I next want to go, thank you, Sherry. And we have tons of questions, so stay on. Lisa, I now want to introduce Lisa Cooley. And Lisa is an amazing self-advocate. I know her because she's such an activist in the self-determination movement. She is the chair of her local advisory committee at her regional center, and is also featured in our great book on self-determination called Profiles in Self-Determination. Wanted to ask you, Lisa, about what protective measures are you taking? Are you leaving your house? Like, now things are opening up. Are you planning to go to Disneyland, which apparently is open? So, tell me about what you're thinking about.
No, I'm not going to Disneyland, but I do get out of my house and go for walks from time to time.
Do you wear a mask? How do you protect yourself, Lisa?
I wash my hands a lot.
But do you wear anything over
and
your
use hand sanitizer?
That's good. Do you wear a mask?
Yes, if I'm going to a public place.
You will wear a mask. Okay, good. Do you know of other people with cerebral palsy who maybe it's very difficult for them to wear a mask? Have you heard of those folks and maybe have any suggestions for them?
I haven't talked to other people that have CP with difficulties with masks, but I would suggest getting a welder's type mask if you go out in public to protect yourself.
Yeah. Yeah, and I think maybe one of these face shields, I can just tell, somebody had asked how you get a face shield. The regional centers are not the ones handing them out. It is the State Council on Developmental Disabilities, local regional offices.
Your local regional office has the masks and the sanitizer.
Yeah, and the face shields too.
And the shields.
Run out and get a face shield for myself to put on to show everybody. I'll do that while we're asking during the next section. Wanted to ask you, Lisa, another question. Do you live with your family now?
I live with my family.
And so your parents, what kind of precautions are your parents taking to make sure they're not bringing it? Like, are they doing the grocery shopping? Who's going out there? So what precautions are they taking to make sure they're not bringing it back to your house?
They wash their hands all the time.
Okay. You know, it's interesting you say that, Lisa,
and use sanitizer.
I was watching Dr. Fauci,
and use sanitizer.
Right. Dr. Fauci was saying that the number one thing he recommends for everybody is to wash your hands constantly. I can tell you that my hands are dry and chapped because I wash them so much. We know that lots of people with disabilities don't wash their hands well, or they're unable to wash their own hands. So it's really up to those of us who support people with disabilities to make sure that we watch them as they wash their hands, or we wash their hands for them. All right, so Lisa, did you want to add anything, or can I start with questions? It's up to you.
Make sure that if someone has a disability, if they can't wash their hands, family members or support people frequently wash the person's hands and wash their own hands so they don't accidentally spread COVID to the person they're helping.
Got it. Thank you. All right, Lisa, thank you for that. I'm going to go to some questions for all of you right now because I want to make sure we have a lot of them. I want to make sure we can get them all answered. Here's one. I don't know if you've heard about this, Laveeza, Dr. Bhatti, and I know maybe Carolyn, you have. A recent LA Times article highlighted the risk for the developmental disability community, but says that getting health outcome data from state agencies is challenging, including California. Do you have any perspective on access to COVID rates for people living with developmental disabilities? I know that regional centers are supposed to be keeping track of the number of people who have contracted COVID, as well as the number of family members, as well as the number of staff that support people, and that that data is supposed to go to DDS, and that DDS is supposed to provide that data to the community. I can tell you I was on a statewide phone call about this issue and others related to COVID yesterday with DDS, and really talked about how there's been a major lack of transparency within our community of how people, we also want to know where people contracted it. You know, the vast majority, I would guess, are in congregate settings or in like nursing homes or something like that. So I'm wondering, Laveeza, how are you guys tracking at Westside Regional Center? How are you getting, I don't know if you know how that information is getting to DDS, or what would be your recommendation?
So I don't know how the information is getting to DDS, but the regional center is keeping a record of all the information that comes in. So if there's a resident that gets reported as being positive, then that is kept, it's basically being logged, and then all the support people that come in and our support agency that is there, all of that is getting logged, but I am not sure how it is transmitted to DDS.
Okay. Yeah, I mean, I happen to know that the regional centers are required to fill out what's called an SIR, or Special Incident Report. The reason I know this is because our family was affected by COVID. We had one of our caregivers test positive for COVID. And so we know that the regional center had to fill out a report on that. And then those reports go to DDS. The question is that DDS has then not really been providing that information on a consistent basis to the community. And I think it is critically important that families know, you know, what if there's a COVID positive case in a group home, and especially now that they're starting to talk about reopening congregate day programs, my gosh.
Or in supported living.
Or in supported living, absolutely, absolutely. Here's a question that anybody can take. How are conversations going regarding informed choice and creating a balance of important to and important for? As we do not want to restrict people's rights, but also want to keep people safe and healthy the best we can. That's Brittany Wood. That is a beautiful question. That is something that we care about deeply here at Disability Voices United. We talk a lot about person-centeredness. We talk a lot about self-determination, as well as supported decision-making. And the supported decision-making piece is so critical. I mean, we have a friend of our organization who his mental health has been so affected by this isolation that he's actually said, I would rather get COVID and risk dying of COVID just to get around other people. And so how do we support people with disabilities in making informed choices while also protecting, you know, their safety and health? So I think maybe I'm going to start with you, Carolyn, since you're a social worker and have to maybe advise some, you know, particularly young people who may think that they're, you know, impervious to getting this or getting very sick from it. So Carolyn, unmute yourself. I'd love you to answer. And I'm going to go and get my shield so I can show everybody.
Okay, so that's kind of a hard one because I think we need to tease out really, and a psychosocial assessment is what I would do, is as far as who do they live with, who's around them, how much are they getting out, any past history of mental health issues like anxiety or depression. And of course, who's their support system? And maybe we need to bring people into their lives, or if they don't have a big support system. But I would definitely make some kind of behavioral plan, at least for phone calls, Zooms, maybe getting together with only one other good friend, where you both decide, you know, you're going to follow the same strict kind of guidelines in your home, and who you're out with and who I'm out with. If I met that young man, I'd say find that one friend who's also living alone, and get together. Social distancing. You know, I visited a neighbor at more than 6 feet away with a mask on, because she lives alone and she's used to babysitting grandkids. She's used to having her kids come over and getting out of the house. And so for a while, when she wasn't doing that, that's what I was thinking. So with this person, I would think the same thing, that you really need to look at all areas of their life, past and present, and try to work on a future plan that they might feel more comfortable with, making sure that people are always checking in on them. So that's not, I don't think there's much more I can say. Maybe Doctor can add to that.
Yeah, and I was just going to add that one thing that has been successful, you already mentioned it, is Zoom. It's really the fact that you can bring in a bunch of people, and even if someone is not fully paying attention, just seeing all the familiar faces on a screen is very soothing. So I think that one of the things that I have said in somewhat similar circumstances where it's difficult to go out is at least set up a Zoom, have them see, they just come and say hi, and if they don't want to, but just have them in the background, see that, and that has helped. So I mean, Zoom is my go-to in these circumstances. So
yes, I agree with Dr. Laveeza. That's true. That has been very helpful for Joseph, having his Zoom social skills online and visiting his friends on Zoom and his dance classes. It's very comforting when he's having those dysregulation and a lot of anxiety, seeing familiar faces.
Yeah.
And just continuing trying to get him to understand what's going on. Social stories, just breaking it into little pieces for him. So he understands a lot. He understands there's something weird going on out here. He walks around with his mask on in the house all day now. It's just, he won't take it off. It's just, now it's a problem.
We had somebody in the chat give a great idea, which is to make the masks and the shields your own by decorating them. I can tell you that Disney has come up, I don't think they're on the market yet, but they've come up with a set of Disney masks where you end up looking like the character. So you have this mask that makes you look like Mickey Mouse or Stitch or Donald Duck. And I want to see the point where, when we get to the point where they are fashion statements, your favorite college, your favorite football team. And so hopefully that will
your favorite colors.
Your favorite colors, so that it's, you know, we right now, there's this whole anti-mask movement in certain parts of the country, and not certain, it's everywhere. I went to Manhattan Beach in Southern California. Nobody was wearing a freaking mask, and they were walking close to me. So it's not just, I mean, people want to say in Republican places. This is liberal Southern California, and nobody is wearing a mask. And so we have to, I'm hoping that we can do this so that it becomes like a fashion statement. That's a really cool mask you got on. You look like Mickey Mouse. And so it makes it more desirable. Speaking of masks, I have found it, my husband put it in the garage, so I had to run around finding it. Here are what the masks, oh, you can't see it. Hold on. I'm going to take off my silly little DVU background so you can actually see me better. Okay. So here is the, it's just a clear, it's actually a very simple little thing. It's got a very cushy top, and it has just a set of elastic. This could not be a more simple product, but you put it over your head like this. Hold on. You put it over your head like this. It's extremely comfortable, and I don't like things on my head. And it goes down for me below the chin. It's relatively long, and there is
like a welder's mask.
So this is what you can get for free from your State Council on Developmental Disabilities Regional Office. I will put it in the in the chat, the link to finding your regional office and how you can request it. You can also get it. A lot of community organizations have been given these masks to hand out. I know that you know, organizations that are really grassroots here in the LA area, like the Integrated Community Collaborative, the Autism Society of Los Angeles, have all been given masks, and you can go pick it up from them. Masks and gloves, these shields, as well as hand sanitizer. So really encourage that. All right, we have another question. I don't want to lose Laveeza. What are your thoughts on the surge homes being developed by regional centers and DDS to handle either consumers who get coronavirus and are in a group home or in supported living? Are these homes for consumers who get coronavirus or for consumers whose staff or parents get coronavirus and there is no one to care for them in their own home? Are the surge homes increasing the risk of getting coronavirus from the caregivers who are there, or perhaps other consumers who may be in other rooms and have coronavirus, but due to ventilation issues may increase the spread of coronavirus? So I don't know, Laveeza, are you aware of these surge homes that DDS has created in the regional centers?
I've just heard of it. I certainly don't know all the details, but it does make sense. Think of it like a hospital ward, for example. You have, like for example, at Cedars, they have like a whole section, which is a coronavirus section. So it's the same virus. So if somebody else has this, you're not going to get anything different. People that have it already are not at risk of getting something more. Also, the caregivers that come in, the whole system is also, I mean, generally in the hospital, you have a different filtration system. So I presume that there'll be something there to, in terms of the ventilation and for keeping it safe for people that come in, and the people that come in will have adequate masking systems in place, whether it's an N95 or whether it's a whole dress or whatever. So I think it's going to be a safer place. That's what I would say.
Great. Any other comments? If anybody knows about it, you may not have heard about it. Yeah, what I've been hearing is that they've rented hotel rooms, they've rented Airbnbs, so that if there is a surge, for example, if there's a group home and one person gets sick, you have to move that person out. What we know about the coronavirus is that close contact with people is your most likely chance of getting it. And who are you most close to? People who you live with, right? Carolyn, did you want to make a comment about day programs? Oh, you're on mute.
Yeah, okay, there we go. Yes, while we were talking, I just got an email back from the day program. And what I found was interesting, so I thought everyone kind of should know, especially us to look into, is that she said, because I asked if they got any guidance from DDS, and she said, no, they have not received any guidelines from DDS for facility protocol. Mm-hmm. As an agency, we're working with each regional center to establish a set of practices that will protect everyone. That surprises me, to be honest. Although she did say having sanitizer available for routine use is a reasonable request. So she did like that idea, but I think that's something, Dee, you can look into, because I think there should be some general protocols, especially that DDS does, that are guided by doctors, by people, you know, who know the most.
Thank you. I'm sorry, I'm trying to get the link for people to get your PPE, but I haven't found it yet. Not easily found when you go to the State Council website. If anybody is on this call from the State Council and knows an easy link for people to get PPE, or personal protective equipment, please put it in the chat, but I will do that. Amy Westling is putting in the chat, and I was on this call for a while yesterday and today, is that, that they will be issuing more guidelines for day programs very soon. They have come up with a plan that they talked about today that they call reentry. I have some really significant concerns about this plan that was literally just talked about within the last couple of hours. So it is very new and I need to spend a little more time looking into it. One of the concerns I have is that the plan it's a draft plan. Amy wants everybody to know that it was developed working with regional centers and working with the day program providers, but without actually consulting people with disabilities who go to those programs, as well as the family members. And I think that it's really important for us to be part of what makes us feel safe. What is it that we want to be done? And so I'm hoping that they'll really start including more of us in this conversation. So what we're doing, Amy wants everybody to know, because I always want to speak on behalf of Amy Westling, that that regional centers saw the draft for the very first time today too. So that is probably not great. So I'm going to move on. I have so many more questions to ask, and I know you may have to rush off. I'm sorry, Laveeza.
Oh, no, it's fine. I can hang on.
Here's like just a basic question. So a lot of people with disabilities don't have their own car, and they're going into the car of their supported living provider, their independent living provider, or other staff. You know, they're riding in a car with two people and the staff member is not part of their household. Should they be wearing a mask? Because this person is not, they're not seeing them all the time. They're going into different cars because maybe they have multiple caregivers. How much should the car be wiped down? Can just the person going into that car touch something and get coronavirus? So tell us what you think, Laveeza.
So I think that absolutely the mask is absolutely needed. The car should be ventilated before they get in. It's a good idea to get the windows down so that you can actually get some fresh air into the car. If possible, keep the windows open. If not, it's fine as long as you are masked up. Now, the question about getting it from surfaces, while it's possible, it's not as efficient a method of transmission as the respiratory route. So as long as when they get in, the hands are clean, they get out, they have a hand sanitizer, they wipe their hands, it should be fine. And I think the instruction also of not to touch the face, because this is not a virus that's going to get in through a cut on your skin, it's going to get in through the respiratory route. So touching your nose, lips, eyes, all of those, as long as that is instructed and basically followed to whatever extent, the mask, having the car ventilated, some open windows, and hand sanitizers or hand cleaning wipes should be sufficient.
Okay, thank you. I have a few, this is from Krill Hayward. I have a few consumers who are being told they need to go back to work, mostly in nonprofit spaces, much more quickly than they were told would happen. How should these folks communicate their unwillingness to go into work, feeling deeply unsafe in their work environment? So I definitely want to ask you for that, but I also want to mention that we're doing a whole webinar in 4 weeks specifically on employment, and schools. But go ahead, Laveeza. What do you think about people with disabilities having to go back into the workplace?
So the issue really is that is the person with the disability able to follow what the general instructions are? If they're able to wear a mask, if they're able to keep their hands clean, if they are able to do what others are doing to keep themselves safe, then it's reasonable that they should go back to work. Does that make sense? Mm-hmm. Because you want them to be in as typical a world as possible. If others are able to do it, the only time that I would be concerned would be someone who cannot keep a mask on, does not want any hand sanitizer touching their hands. It's a goopy substance. Some people don't like it. are not able to wipe their hands down. That would be the concern. Now, the other aspect really is more a psychological thing. What is it that you feel so deeply concerned about in terms of your own discomfort to go to work? And I think that really needs to be addressed, because if we can't just look at, okay, this is a practical measure, do it. Some people are totally scared of the virus. They're unable to function till they think that everything is safe. So we have to take both of these aspects into account, because we can't, I mean, what I'm saying is I can't just presume that somebody is fine if I just put a mask on them and tell them to wipe their hands. What are they dealing with? The psychological fear of being in that environment. Unless that is addressed, it's a setup for failure.
Mm-hmm. Thank you.
Can I make a comment on that?
Yes, please.
This didn't happen with someone with an intellectual disability, but on the same thing that the doctor was saying, I have had a patient, an employee that was so overcome by the fear of getting COVID that I sent her to a psychologist to get assessed for mental health, anxiety, to get her disability actually for a time, and then to work on how to deal with her anxiety and come back to work eventually. But it's so true what the doctor said, that some people are so overwhelmed. They do not want to leave their house. They do not want to go to work, especially here, because you're working in a hospital. People are thinking more fear. But so that does happen. I just wanted to add that.
Yeah, I have to say that I was paralyzed with fear as well. I have an underlying health condition, and I was paralyzed with fear. And I have not been in a store, in an indoor building, with the exception of a doctor's office once, and that was just this week, since March 13th. I am so absolutely terrified of getting this. So I get it. I get it, people. Okay. Here's a question from Connie. DDS is faced with an unprecedented $500 million budget cut. Today, I learned from my own regional center that 2 have died and 12 have gotten COVID in our county. How can we suggest to DDS that they get this data from each regional center and that it be made public to hopefully influence legislators? Our caregivers and population is at much higher risk, and yet we are not getting the funding to protect them. I'm gonna, you all can comment as well, but I'm gonna try to take that question since I'm the policy person here. But it's, you know, I have really been requesting this information. And the only way that we can get this information is from each of the 21 regional centers who funnels it up to DDS, and DDS has to get this information out to us. It's critically important that we have a sense of how prevalent COVID is in our community. The other thing that I would say about this is that even if the regional centers, I mean, we know the regional centers are providing the information that they have to DDS, but they don't have all the information. Regional centers do not know if every single consumer and family has been affected, because they haven't been doing their best to contact us. We did a survey that showed that half of the people who responded to our survey had gotten no contact from their regional center, had gotten no call finding out how they were doing. But even if 100% had said, yes, I had that contact, my original contact was 2.5 months ago. I could have gotten COVID since then. We need to have regular, consistent contact by regional centers to make sure that nobody is falling through the cracks. And so that's something that I've been advocating for on many of these webinars. I think that is an excellent use of the time of regional center staff, is to be in a regular contact with people right now, and also providing assistance if somebody does become infected. Okay, and does anybody want to add to my little tirade there or no? Okay. How do we best educate individuals who are high risk for COVID-19 that due to medical reasons that they are at high risk? As communities begin to open up, how has that informed the decisions made to resume activities that individuals previously enjoyed? These webinars are such a great resource, but there are other plain language resources that folks are using? I can say that on our coronavirus website, we have some really great plain language materials written by people with disabilities that are great to use, social stories and other things. Lisa, do you have some other ideas?
The state council has plain language COVID resources that people can gain access to. Just call the state council office to get them.
They're on the state council's website, and I put the state council's
or
website.
Get them off of the state council's website.
Yeah, exactly. What if parents get sick who are caring for their disabled child? Is it safe for the consumer who is not sick to be sent to a surge home? So that's like the major question is you go to this surge home so this is my understanding of these surge homes, is that they're not going to have a surge home that is both with people who are sick and not people who are sick. They will have homes for people who are not sick and not intermingle them with the people who are sick. So this hospital ward analogy that Laveeza was talking about are for people who've actually contracted COVID. But then there are also people who need to be removed from their home to avoid them from getting sick, to keep them from getting sick, who are going to be around healthy people. Of course, it is exposing them to staff who are coming in and out, so they're clearly more exposed than they would be if they were isolated at home where nobody's sick. But honestly, from the studies I've read, I think it is the safest thing you can do is to get people away from people who are sick. Of course, there's lots of there's mental health consequences to that too. Carolyn?
So for the girls, what we did is we decided in the beginning, and I think I forgot to say this, is we made a plan. If one of them gets sick, what are we going to do? So we all decided that we would remove the person who's ill from the house. Of course, it would then get cleaned, so the other two girls, hopefully, who might be asymptomatic at the time, never get symptoms and never get sick. But we decided to remove them out of the house. Now we're lucky. I know that our young ladies have a strong family support, and others may not have some place to go. So I believe that DDS has money and availability to help place them somewhere with staff that would support them. Of course, that's if they're sick, if they need to leave where they're living. But of course, that's not a great situation to have people who don't know you to all of a sudden start taking care of you and being your caregiver. I think that would be a really traumatic event for a lot of our people. Mm-hmm. But from what I understand, that they have made a plan to do that.
Yeah. Somebody was just asking a general question, when are the day programs going to be opening up? There was a meeting about it today. The Disability Services Task Force subgroup met about it today. They do not have a specific timeline. They are not going to have people open up, have organizations opening up without meeting some sort of approval. But I do have to say that some day programs are already contacting their clients and saying, yeah, we're getting ready to open up. We're actually taping 6 feet boxes on the ground of our center. I mean, it's like, oh my God, as if my son would stay in that box. So, we are, and I know that DDS and regional centers want to make sure people are safe. So I know that they will be involved and not just let day programs open up willy-nilly, but I'm here to speak to families and to people with disabilities to say, please don't run back to your day programs. You don't know whether they're safe yet. You need to make sure they've been checked out by your regional center, by some other agency to make sure that it's safe there. Just don't go running back, because there's a lot that needs to be done before they can be opened up. And I don't think they'll ever, we're doing a whole webinar on this in a couple weeks. I don't think they're ever going to look the same ever again for history in the future, because we have rules called the Home and Community-Based Services Rule that are coming into effect in March of 2022, which requires people to be only in community-based settings. And so why put them back into these segregated congregate settings when they're going to have to change in the next year anyway? So I think we have to reopen in a way that's smart, safe, but also is person-centered and individualized.
I think the other complicating thing also is that, like you said, it's the 6 foot boxes. There's no way that you're going to be able to keep a very socially interactive kid running around doing high fives, wanting to hug someone. And I think we have to take into account that if the Cal states aren't opening up, there is a reason that they're keeping groups of people away. So I think it's actually more caution needed in our population than it is in a public university setting. So we need to be much more careful with who we send into a room where mostly they spend their whole day. So.
Yeah, oops, sorry, that's somebody calling me. So, okay, here's a question. Can the shield type mask allow the person to eat with it? Well, let's check. I will be your model. So you put it on like this. And yeah, I mean, I guess you could theoretically eat underneath it. You would have to push it back a little bit, but actually it is safer than just taking off your mask and having your whole body exposed. So I guess that is a safer idea than having nothing. So yes, you can eat. I have not yet, I just got this mask like 2 days ago, so I have not yet experienced it in the real world. So let's see. So somebody was asking about the data that I provided from our survey, which says, when was the last time your data was updated in regard to contacts from regional centers? Because we had when we put this out a few weeks ago, we said that we had received 435 responses out of 350,000 people is what was reflected. Has that increased with time? Well, in my career, before having a child with autism, I actually did public opinion research and surveys. I mean, that was what I did for a living. So I can tell you, you don't have to survey 350,000 people to find out what's happening with 350,000 people. You can get a representative sample. So I'm saying that, but I'm also going to say we now are up to about 450 or 460 because we've actually closed it. So we don't have that many more people coming in. But I can tell you that our survey was taken and was also provided by other organizations. Disability Rights California has done a survey, and a group up in Northern California called Las Familias in Spanish did the survey. Almost exactly a lot of the same words that we used, and found identical results. And they were hundreds of additional results. In fact, we just got the La Familias results today, which we're going to incorporate into ours so that it will be a more robust response rate of well over 550 people. So, so I can tell you that that even the Regional Center of Orange County did their own survey and found that only 65% of their families and consumers had received a call from their regional center. So this is a regional center's own survey, found out similar results to ours. So I think we can all do a better job of reaching out and making sure that nobody falls through the cracks. And to that end, we have a question of why aren't regional centers being more proactive in communicating their plans and support options for responding to COVID cases. You know, I think that, there's 21 regional centers and they're doing it in 21 different ways. Just like there's hundreds of school districts who are responding in hundreds of different ways. I think I've always felt that transparency is the best policy, to be as open as possible, letting people know how many cases you have. I heard, I was on a call recently, I think it was yesterday, one regional center is having weekly phone calls with their community. Everybody can ask questions, providing weekly updates. That's a lot of transparency. Another regional center is putting out a weekly newsletter with COVID updates, giving statistics. So I don't think it's a one-off where you do like one town hall and then you never come back. I think there needs to be regular opportunities for people to ask questions, get feedback, and just feel connected to their regional centers. And so I really urge regional centers to be providing that kind of support. I mean, I'm wondering if anybody here has any other ideas for regional centers of the kinds of outreach that they could be doing to make sure that people are safe. I don't want to put you on the spot, Laveeza, as a regional center person, because you're a physician, you're not doing the policy at your regional center. But I mean, what more can we do? I don't know, Sherry, you have any ideas, or Carolyn, or or, you know, Lisa, if you.
Occasional check-ins.
Yes,
Yeah.
yes. More contact, more follow-ups, more, especially if you know certain families, that caseworkers should be more involved in their caseloads and know a little bit more the family's dynamics, you know.
Yeah.
And I think now
Caseloads. Sorry.
and now there is this time, so there really should be at least twice a month contact at a minimum with the family. So that should be the minimum requirement, that the service coordinators contact and every person on their caseload at least twice a month on a minimum basis.
Yeah, I agree with that. I was lucky. My new case manager, because we're now finishing our self-determination plan, called every week for probably a month and a half, and then it's dropped off a little bit, but we're emailing about self-determination, so he's always checking in. And I think that even though things are changing constantly about what we know about COVID and our population, that they need to post on each regional center website something about COVID and update it, because I think people need to be updated on how it relates to our population.
Yeah. I agree. I'm wondering, Lisa, how often have you been hearing from your regional center?
Speaking of that, what is today? Thursday. Yesterday, as a matter of fact, the executive director of my regional center, who I know very well, asked how I was doing.
That's great. That's great. That's good. And it's, you know, it's important. I mean, what I was saying on a call yesterday with DDS is that it can't just be people like Lisa, who is super involved in the community, is an outstanding self-advocate that's well known, because Lisa knows her executive director of the regional center and can call and say, hey, I need this, I need that. I'm the same way. I can pick up the phone and I know emails of people.
And I also check in with my
you're going in and out
as possible, not even related to the virus, but just in general.
Right. That's good. I'm really worried about those really disconnected families. Those families who maybe don't receive a lot of services from the regional center, you know, with children, or those families who don't understand the system very well, who are really disconnected. Maybe they've lost jobs, maybe they've lost, you know.
And who get intensive services, and like you said, don't understand the ins and outs of disability monopoly like the rest of us.
Yeah. And so, you know, I think that that's why every 100% of people on the caseload, I mean, I have to say that even the people who responded to our survey are generally the families who are connected. Because how would they have gotten our survey if they weren't connected with the various community-based organizations in which we promoted it? So we didn't even get to those truly disconnected members. So the data may not even be as accurate for those people. So, you know, I really think it's critically important that we stay so active with people and on top of them. I would highly recommend every other week. So I don't know, Sherry, how many times have you been contacted by your regional center since COVID began?
Well, they were, one time they were proactive and gave me that one call, but all the other phone calls are me, you know, contacting the service coordinator, because our needs are changing in the household.
Yeah, because you're going to work and your son's not at school.
Yeah, just one call. That's it. That one call, the 2 weeks after we were put on, I like to call it lockdown.
Right. All right, well, I am not seeing any more questions. Oh no, I am seeing questions in the queue. We just got some new ones. I'm trying to start self-determination process, but no one is calling and following up with me on this. My service coordinator isn't that knowledgeable about the process. Who else do I turn to? Well, that's like one of our passions here, because every single person on this call has got into the self-determination program. Laveeza's son and Lisa Cooley's in it, and Carolyn's daughter and Sherry's son. So, and we're all on our local advisory committees, most of us. So that is a passion. So, you know, I think it's really important that if you have not been getting the response from your service coordinator on this, you should, on self-determination, we've been hearing that, unfortunately, in other places as well. I think it's important for you to do two things. Number one, you should contact DDS. That's the DDS email. I'm going to put it in the chat. And this is who you contact about the self-determination program. And you're going to, so it's sdp@dds.ca.gov is the email address for the individuals that help to manage the self-determination program. In addition, you should be contacting people on your local advisory committee. So for example, Sherry's the chair of the South Central Regional Center Local Advisory Committee. I'm the chair of the Westside Regional Center Local Advisory Committee. Lisa, you're the chair of the Alta Regional Center, right? Alta California
Yes.
Advisory Committee. Carolyn is vice chair of the Central Valley Regional Center, right? Wow, I remember everybody's regional centers. So, you know, we're here for you. We're in charge of the oversight and monitoring of the way that the self-determination program is being implemented. We are family members, we are self-advocates, we are people who are really involved in the program. And we're all meeting, many of us, once a month. You can find out when your regional center advisory committees are meeting by going on your regional center website. They're required, by the way, to advertise when that meetings are. They have to give 10 days notice to the community. So the other thing that I'm going to mention once again is that we're having meetings every Wednesday from 5 to 6 p.m. that we're calling the SDP Connect, Self-Determination Program Connect. You can come on with us, get on our mailing list, and please join us, and you can ask those questions and we can try to really get you answers. Okay, more questions. As we open up, it is highly likely that spread will increase. Does it make sense for regional centers to recommend emergency planning instructions, such as getting extra food, medications, so that people will be prepared for the likely outcome that sheltering in place will return? Laveeza, I know Laveeza has another meeting that she has to get to, so I'm not sure if she's still on, so we apologize.
I am actually, I am, but okay.
I don't know if you heard that, but this is actually a question I brought up to DDS yesterday, Laveeza. Like, what happens if there's another, or even in the fall, people are saying it could be worse than it was this past year? What should we have in place? I mean, what should DDS and regional centers have in place?
I think certainly the fact that we've had to deal with it at this time has made us more prepared. So it's really something that we can fall back upon. I don't think that we need to have emergency supplies and everything, because we have a lot of ability now to be self-sufficient in terms of masks and gloves and sanitizers and all of that. I think that just the planning needs to be in place, because what happens if a family member gets sick? What happens if more than one person? So I think that planning has to be in place. I don't think there's any need to go beyond that.
Anybody else have any ideas on that?
The only thing I'll add to that is, you know, I take advantage that most medication plans are allowing for 3 months of supply. So I would get that set up with your doctor in case you're worried about getting your medication. I think that's the only thing to add.
Okay. Yeah, I actually asked this question on this task force I sat in on yesterday to say, you know, they're having all these re-entry plans. It's like, what's the trigger that then makes us close down again? Now, of course, we don't control whether the governor or the counties decide to close down. So, and DDS certainly doesn't control that. So what can we do in the absence of leadership? Like, honestly, I just read an article today in the LA Times saying, we're too far into this reopening, we're never going back. Like, regardless of how bad things get, we're never going to go back to where we were before by closing things up with stay-at-home orders. That scared the life out of me. I mean, that is really scary that we don't have a backup plan in case things get much worse. So that's where we have to take care of each other, take care of ourselves, and say, okay, fine. The leaders, our elected leaders are not doing their job by mandating things close down. Nobody can force us to leave our home. Nobody can force us to go to Disneyland and restaurants. We're going to stay home. We're going to hunker down. As much as it's frustrating, as much as it's annoying, we have to do that. If there's a spike in numbers, we have to take care of ourselves and not say, yeah, but Johnny down the street's going out.
No.
Johnny doesn't have underlying health issues. Johnny doesn't live in a household where somebody has an underlying health issue. We're going to stay.
Everything related to COVID is individual. You have to do what's best for you or your loved ones.
Yeah, exactly.
I just wanted to add one thing, Judy, that I think that doing telemedicine is something that has been really, really excellent for a lot of people with disabilities, but there is a lot of resistance too. Like I've had patients say that we don't feel like we're getting adequate care if we don't come in person. It's very hard for a lot of people to come in person, and with Zoom, you can actually do a really amazing visit with a lot more attention rather than being distracted by behavioral interventionists being there in the room, multiple people. It's actually working really well. And I think we need to address the issue that it can be a comfortable way and an alternate way for people to make appointments. And it's actually just as good, in my opinion, as an in-person visit. So that's something I think we need to raise awareness of, that you do not need to absolutely be seen in person.
Mm-hmm.
So.
Yeah, I actually am having a visit with my doctor tomorrow on telemedicine for the first time.
Yeah.
So we'll see how that goes. Right. Somebody was asking how they increase their respite hours right now. So obviously, you need to call your service coordinator to ask to make that request. But you should know that regional centers have been given a lot of flexibility in being able to increase services and supports to meet the needs of the COVID pandemic. And there are a lot of people who've gotten approved increased respite or personal assistance hours. There are others who haven't. And you absolutely can challenge. If you haven't gotten what you need to support you, I mean, if you're home from school, if you're home from work, you should be fine. And your regional center is refusing, you can go to DDS and ask for help and ask DDS to weigh in, or you can go to fair hearing. You still have the same rights to due process. Due process will not be in person. It will be online, but you should definitely challenge it if you're not getting the respite that you feel you need to stay safe. Okay, this is gonna be our last question, and then we're gonna end the webinar. And for those of you who, I'm only using the Q&A, so I know there may have been some questions. Oh no, one more just came in. There may have been some in the chat, but I will, it was really hard for me to monitor all that. Okay, so will any future webinars provide a menu of alternative service options to replace day program services? Yes. Our webinar in 2 weeks will be discussing congregate and day programs and what the reopening would look like for them and how they should, in our opinion, look substantially different. So yes, the answer is for sure in 2 weeks from today. Hi, Joseph. And then let's see. Okay, so I think that we're going to end it right here, though. I want to thank our amazing presenters, Dr. Laveeza Bhatti, Carolyn, Tellalian, Sherry Johnson, Lisa Cooley, our wonderful interpreter, Lorna Silva, and our program assistant, Ed Herzl, for this great webinar. It is part of a 4-part series that I'm going to remind everybody of the dates. Right here, next week we'll be talking about inclusion no more, people with disabilities being left inside while the world reopens. June 25th, congregate and group settings can't go back to the way it was, what I was just talking about. And finally, on July 9th, getting back to school and work, what will education and employment look like for people with disabilities? Thank you all again for being part of this webinar, and we have recorded this webinar, and it will be available both on Facebook as well as on our YouTube channel and our coronavirus website. Thank you all, and stay safe out there, even with the reopening. Stay safe out there. Take care.
Bye-bye.
Thank you.